Hi, I'm going to present the results of a systematic review on barriers and facilitators to fecal sludge treatment in humanitarian camps. So humanitarian contexts are particularly vulnerable to poor wash access, and the current practice for sanitation is to collect this sludge and then discharge the untreated sludge directly into the environment. So that causes environmental and public health risks. There are also several constraints in humanitarian camps to implementing sanitation solutions, like non-supportive local authorities, displacement of populations, lack of space, and densely populated area. The emergency interventions are often not evaluated, or the results are published in grey literature rather than peer-reviewed literature. So it's not always easy to access. So the objectives of this study were to collect and synthesize the experience from humanitarian contexts and to identify the barriers and facilitators to understand the blockages to better fecal sludge treatment. For that, we did a systematic review in 2020 of 8 journal databases and 39 international organizations' websites. We included documents that had an assessment of fecal sludge treatment interventions, both on-site and centralized, and that were implemented in humanitarian camps. We also evaluated the quality appraisal of evidence using the bond evidence checklist. We started with more than 18,000 documents and ended up with 49 documents included. We found 403 barriers and 402 facilitators, 70 interventions. The interventions were implemented in 12 countries, with almost 70% of them in Bangladesh. We identified 22 treatment modules, with lime treatment being the most implemented one. The quality of evidence was weak overall for more than half of barriers and facilitators. The first category that had the most barriers and facilitators, 23%, was performance. The main barrier was when the limit values for the effluents were not met or not for all parameters. The main facilitator was when the system had high removal values. The second category was operation, with 18% of all barriers and facilitators. The main barrier was when the systems needed strong supervision for the operation with frequent labor or specific technical skills. For example, in this picture, 4 people are needed to bring the sludge from the truck to the dumping station. On the contrary, the main facilitator was when the systems were easy to operate and maintain, requiring low skills and limited interventions from the staff. The third category was a technical category with 13% of all barriers and facilitators. The main barrier was when the system were over or under design or the wrong type of material was used. For example, in this picture, the constructed wetland is overflowing because there is higher volumes of sludge entering the constructed wetland than what it was designed for. The main facilitator was when systems were easy to scale up by adding modules in parallel to account for the influx of people. So overall, there is a lack of high-quality information on fecal sludge treatment in humanitarian camps. The evidence was weak overall, and most of the interventions were implemented in Bangladesh, so a lot of humanitarian contexts are not covered. We found that the barriers and facilitators are mainly linked to the treatment itself or its design and less to the context or the environment of the intervention. So making the right decision before implementation is key. We also found that most barriers could be mitigated by facilitators and by the selection of the appropriate treatment system or by adapting the system design. For example, in this picture, it's a drying bed implemented in a context with heavy rains. So adding a roof over the drying beds can limit the additional time it will take for the sludge to dry in rainy season. So overall, it's important to have additional implementation and reporting of fecal sludge treatment activities in humanitarian camps, with a focus on increasing the quality of the evidence by using templates for the reporting of methods, for example. It's also important to properly select and design the systems before implementation, so working with professionals that have the adequate skills and training for the selection and design of the treatment systems. Thank you for listening.